Welcome. Using this platform to be able to answer questions regarding your heart health and prevention. Let me know what questions you guys may have, and I'll do my best to answer it. If not, it's gonna use this session to just gonna study and get ready for my patients. So one of the main reasons for doing this is the importance of prevention, but also the importance of knowledge. So if you understand what risk factors for heart disease are, you can potentially prevent a heart attack from happening. If you understand that things like high cholesterol, diabetes, hypertension, obesity, not working out, sedentary lifestyle, smoking, all of those can progressively lead to heart disease to happen. If you understand that now, you can hopefully prevent a heart attack from happening. So one of the questions would be, who am I to be able to give this information to people? Well, my name is Dr. Isang and I'm a cardiologist. It took me 14 years to get to where I am right now. This includes 4 years of undergrad, 4 years of medical school, 3 years of internal medicine residency, and then subsequently 3 years of cardiology fellowship. Within cardiology, you can subspecialize even more into things like interventional, heart failure, electrophysiology, but I chose general cardiology. My wife is a OBGYN, so have to choose something that gives you the best opportunity to have a good lifestyle. So when it comes to heart disease, like I said, it's important to understand what the risk factors for heart disease are. Things like hypertension or high blood pressure. So if you do have that and if you treat that, the hope is that other things are well controlled and you're preventing heart disease from happening. So what is considered high blood pressure? Well, when the top number is greater than 120, between 120 and 129 is considered pre-hypertension. Over 130 is stage 1, over 140 is stage 2. So depending on what stage of hypertension you have, you can treat that with lifestyle changes, with working out, losing weight, getting adequate sleep, treating sleep apnea. But if you have stage 1 and stage 2 hypertension, you want to kind of think about medical therapy, so things like calcium channel blockers, ACE inhibitors, beta blockers, aldosterone receptor blockers. They all work well, but you got to look at the side effects that are associated with them. Some of them can cause ankle swelling, some of them can cause issues with potassium, so if you already have those issues, it wouldn't be the best to start that specific medication. If you guys are just coming in, let me know where you guys are checking in from. So what does a cardiologist do? A little bit of everything. Right now, finishing up some notes. Have some EKGs to read off. This may criteria. 2-wave inversions. Yeah, okay. Let me know where you guys are checking in from. Welcome, welcome. We just talked about, things to know regarding your heart. The first one was hypertension. What is hypertension? Ways you can treat it naturally, and then if that's not working, what you can do to get it treated. And there are some, like I was talking about, there are some medications that you can utilize to get it treated. Sometimes, if they're not working, and if you're on multiple medications, we have to look to see if you have any underlying issues that can be causing the blood pressure to be difficult to control. Vitamin D deficiency. So in addition to high blood pressure, another topic that we frequently get is, let me know if you guys can hear me okay though. Um, don't want to talk too loud because I don't want to bother my colleagues. But another topic that we get a lot is chest pain. So as a cardiologist, what is chest pain that gets me concerned, get me nervous? So is chest pain here, pain that's worse whenever you exert yourself or whenever you're moving around, climbing a flight of stairs, running, and pain that gets better with rest, or a medication called nitroglycerin. What that medication does is to help to dilate blood vessels, so it's alleviating that pain. It can be used for other causes too, but um, when you have those pains, uh, definitely want to be seen soon by a medical provider, whether that's your primary care, urgent care, or ER doctor, because that pain can be due to potential blockage. It can be due to a impending heart attack. So when you have that, go get seen. I'm getting cold. Sorry. Whenever you have that, go get seen as soon as possible because we want to rule out life-altering conditions such as coronary disease or blockage in the heart arteries. We can do that in several ways: stress test, or cardiac catheterization. You can also do a CT scan of the coronaries, which is non-invasive compared to a heart catheterization. If there are blockages, we can open it up with a stent. If there are several blockages, then we have to consider open heart surgery. And sometimes if the blockage if there's no blockage, then we have to look at other causes of the chest pain. You can have issues with your gallbladder, with your pancreas. All of those play a huge factor into it. So if you're if the life-changing, life-altering conditions have been ruled out, then still want to look at other potential etiologies and causes of it. K-pop, what is going on? It says I'm having back pain, mostly upper sides and back. Student, so I do a lot of studies. Can you tell me how to get rid of it? Back pain, upper side. And I think you may actually benefit from seeing a physical therapist so they can do some exercises to see if there's any areas of your back or your shoulder that's weak and you're compensating from it. So I would go see a therapist first. kind of hard to make that diagnosis this way, but I think you need a thorough physical exam. Upper two sides, yeah. Oh, you're welcome. You're welcome. I hope you're doing well. Thank you for the question. Sorry I couldn't help as much, but I think if I was in that way, I would definitely go get seen by a physical therapist. I have my own personal physical therapist and trainer, so. Yeah, I do like gym. Once upon a time, I was a physical personal trainer. I thought I was gonna go into that realm, sports medicine, maybe orthopedics, but I found my joy in internal medicine. Yeah, just doing for fun. I'm gonna test my body for the next six months. If I get really in really good shape, maybe see if I can't really train my legs as much as I want to because of an injury. So it'd be hard to compete knowing that one side of my body will be weaker than the other. One body part will be weaker than the other. But just for fun, not even for fun, for longevity, I guess is the better answer. Yes. Thought I had two more notes to write, but I just have one. Would you like to show your physique? Nah, I'm good, my boy or girl. Yeah, I remember him. All right, so we've talked about hypertension, chest pain. Next topic is going to be heart failure. So when someone talks about heart failure, when we mention heart failure, and we're looking at the inability of the heart to meet the body's demands. So it could be due to the heart not squeezing appropriately, but it can also be due to the heart not relaxing appropriately. Most common cause of that is something like high blood pressure or hypertension. So some of the symptoms include shortness of breath. They can have a cough, weight gain, leg swelling, fatigue. So when I'm seeing somebody with that, first thing we're going to do is get an echocardiogram. And this is an ultrasound of the heart. Lets us know how well the heart is squeezing. Lets us know if there's any issues with the heart valves, any fluid around the heart. Most important thing is to know how well the heart is squeezing, because if the heart is not squeezing well, it could be due to blockage. So we want to do further testing to look at that blockage, such as the a cardiac catheterization. If there's blockage, we open it up with a stent. If there's no blockage, we leave it alone. And then we have to look at other causes: high blood pressure, sleep apnea, obesity, physical inactivity, autoimmune conditions can all play a huge factor into it. There's different medical therapies that we can utilize for it too, so it can be interesting. 81-year-old female presenting to the office for evaluation, period. Next line, recently diagnosed with atrial fibrillation, period. Next line, on rate control strategy with beta blocker with metoprolol and anticoagulation with Xarelto, period. In the office continues to be an atrial fibrillation, however, rate controlled and without any symptoms, period. Next paragraph, I have completed review of systems with patient, period. Right now, I'm just finishing some notes, so bear with me. If you guys have any questions, leave it in the comments, and I'll do my best to answer it. For those of you guys popping in, this is Dr. Hussein using this platform to discuss anything you guys may have regarding cardiac health, prevention, heart disease, all that fun stuff. EKG showing atrial fibrillation with a heart rate of 78 beats per minute. Excuse me. Can we get records from outside facility regarding echocardiogram, period? Next paragraph, thank you, exclamation mark. So the question is, are there any heart issues this autonomia could cause Typically not. It's more or less the discomfort that comes with the fluctuations in the blood pressure and the heart rate. Sometimes people can have lightheadedness and dizziness and feel very uncomfortable. Good thing is that you got diagnosed pretty early, or hopefully you did, because it can take a while to get that diagnosis made. I do find that other conditions can cause dysautonomia, but dysautonomia causing heart disease itself, typically not. It's more dysautonomia can be an outcome of other conditions such as Parkinson's, diabetes, older age. We'll plan for ego. We'll plan for NT-proBNP measurement period. Next line we'll inform patient the results of them period. Rate control period. Next line on appropriate guideline directed medical therapies period. Next line we'll continue to monitor period. On anticoagulation period. Next line on recommended to monitor for any signs of bleeding period. Next line denies having any dysuria, hematuria, blood and stools period. Continue current antihypertensive period. Next line. Continue with levothyroxine period. Next line. Yuck. Parkinson's runs in family. Took 4 years of complaining. Changed doctor. Passing out. Vomiting. Got it. Yeah, it takes a while. 4 to 6 years is typically the length of time, unfortunately. All right, I got about a few more minutes. Oh, let me just do this. Thought heart murmur was playing up. You know, heart murmurs can cause some heart rhythm issues, but topic of dysautonomia is a huge one because it's very complex. Like I said, and like you experienced, it can take some time to get the diagnosis. We have the benefit that we have a dysautonomia center that is pretty close to us. So I do the best that I can. And if I can't find what's going on, I usually send them to the dysautonomia center. One of the last things I'm doing right now, well, not one of the last things, one of the things I'm doing right now is going to be a reading stress test. This is an indirect way of us looking for any potential blockage that someone may have. If the stress test is abnormal, the next steps is going with a cardiac catheterization, which is the gold standard to see if there is a blockage, and if there is, then hopefully fix the blockage and get the person to feel a lot better. Heart squeezing well, normal squeeze function. This is a normal stress test. This is one of the best things that I like doing, is to tell people that stress test was normal, because it's a huge sign of relief for them. They've been stressing over it, no pun intended. Can you let patient know that the stress test was normal, period, next paragraph, thank you, exclamation mark. I've read your stress test, period. Next paragraph, I am pleased to tell you that the stress test was normal. I've read your stress test, period. I am pleased to let you know that your stress test was normal, period. If you should have any questions or concerns coming, please do not hesitate to contact us, period. Next paragraph, thank you for allowing us to care for you, exclamation mark. I don't think everybody does it, but I like to send them letters to just, not just tell them over the phone, but also a letter. I think those small things really matter. Sometimes they don't get it, which is unfortunate, but all right, it's gonna get dark for like 10 seconds, and then I'll be back outside actually taking a little walk before my first patient shows up. Phone notes, echo, okay. It's about to get dark, so bear with me. Oh.
Good. Great morning.
That one, I don't know. I think it must have come, and I must have missed it, the stress test, but it was normal.
Okay.
Because I know that they'll be antsy about it. How are you doing?
I'm doing well.
How's our hubby doing?
He's doing good. He's putting in bunches of job applications right now. Did you ever meet Nita? She worked with Dr. Malo for a while.
Mm-mm.
No. She went and worked for Cintas,
Mm-hmm.
and she told them to reach out to her.
That's awesome. Fingers crossed.
I think it's really like hit the door running that quick.
We can get him a job here. That'd be awesome.
Yeah, that would be awesome. Invitation to get CNA free schooling, and he could be another member.
Want like Brazil? Ooh, you guys, for the people who stayed, I appreciate that. Now I'm just gonna take a little bit of a walk. I should, it doesn't count unless you these days. But I like to track my walks. I was supposed to be tracking my bike rides, but I thought I thought my foot was ready to start jogging again, and I I was wrong. I went to the gym and worked out. Really good workout, but I used a stair stepper for 10 minutes, and my plantar fasciitis has flared up a little bit again. But at least now I know the things that I can and cannot do. I knew I shouldn't try to jog on it, and I did, and that set me back about 2.5 weeks. I knew I shouldn't try to jump rope, and I did, and that used to set me back about 2 to 3 days. So what did I do when I started feeling better? I jump roped for about 30 minutes, and then I went for a jog, and then that set me back about 4 weeks. So here I am right now trying to get back to where I'm at. And I've been doing good for the past few weeks, just been babying it. And one of the things I ended up doing was going to the gym. And I usually just go and, walk on the treadmill or use the bicycle. But what did I do instead? I used the stair stepper because it's one of my favorite things to be able to use. Um, to be able to burn as much calories and get a good workout in a short period of time. And it felt good until I woke up this morning and I couldn't walk like I normally do. So at least that's just letting me know that my body is not not yet ready for the stair stepper. So I understand that I probably just need to, for the next 2 to 3 months, just a bicycle. I may or may not try an elliptical in the future, but for now, just a bicycle. And I would like to use a walking pad or at least treadmill and walk on an incline to see if my leg will be able to uh, sustain that. What's going on, Sharma? I hope you're doing well. He was just talking about the importance of exercise, but also listening to your body, and I did not, which led to me being in some discomfort today. But yeah, this is a pretty cool walk that's right by my office. So I like doing this walk because it's nice, it's simple, it's close, and it's up to 2 miles long, or I think 1 mile. No, it's up to 2 miles long, I believe. I usually just do a half loop and then turn around. Or there's so many different ways that you can use these loops and use these trails here. And there's one location I have not yet looked at, so I may try to see if I can find that area today if I have enough time. But we've been talking a little bit about everything when it comes to your heart, when it comes to your health. Let me make sure that, well, yeah, it's on. Just want to make sure that people can hear me okay. But we've been talking about a little bit of everything when it comes to your heart, when it comes to your health, palpitations, chest pain, risk factors for heart disease. So if you guys have any questions, just let me know right now. Kind of doing what I preach when it comes to your health and being active, and right now it's just walking. I think that's one of the things that does not get mentioned enough. People want to do these high interval exercises or bodybuilding workouts, but sometimes you can just keep it simple and just walk and watch your body change over time with consistency and with watching what you put into your body. And sometimes you don't have to make it too difficult when it comes to watching what you're putting into your body. It can be as simple as just looking at areas that you need to improve on and working on that, and hoping that the improvement leads to a change in you physically, but also I would also like to say emotionally and psychologically, because you want to look good, but you also want to feel good and feel good about yourself, which is a whole nother topic. But walking is extremely important. Exercise is extremely important. How much exercise is important to a cardiologist? So my biggest recommendation is 30 to 50 minutes a day, um, three to 5 times a week. The more important thing is going to be consistency. So if you can only utilize about 10 to 15 minutes, then do that. But also incorporate a healthy eating habits, and you will see those benefits too. I had one of my friends lose a significant amount of weight, and he did not exercise at all, other than walking and maybe going to the gym 2 to 3 times a month, if that. So it really speaks a lot that if you walk, you will start to feel a lot better. And it's always important to look at the big picture when it comes to your health, when it comes to why you want to be healthy. It's more than just doing it for a physique. It's doing it for long term, doing it for lifelong health, doing it to feel better, doing it more importantly to live longer for yourself, for your family, for your friends. I think this is one of my favorite parts, is coming here, is this area, because it looks pretty awesome, and kind of having all of this in my backyard by my job. It's pretty cool to be able to come here every now and then and just kind of let off some steam, let off some stress. So yeah, I'm pretty lucky. I'm pretty blessed to be able to have this location. There's another side over here, but this side is a lot better, a lot more cooler. Also, anyone who's still on here, if you guys can still hear me okay, let me know in the comments, making sure that I'm not talking to a muted, or that you guys can hear me and that everything is not being muted. Ooh. We've talked about chest pain. We've talked about heart failure. We've talked about prevention. We've talked about hypertension. One of the things that we haven't touched base yet is palpitations. So it's one of the common things that we see in the hospital, palpitations and abnormal heart rhythms. So palpitation is that sensation that your heart is skipping, pause, thump, just an irregular beat. It is what you feel is palpitations. What it really is could be something different for each person. Can be some extra beat coming from the top or bottom part of the heart. Could be atrial fibrillation. Could be nothing. I found that a lot of people have palpitations, and we do this workup, and it comes back being unremarkable, or we don't ever find a cause for it. But if someone has palpitations for the first time, and I see them in the hospital or in the office, one of the things we're going to want to do is get an EKG. And the EKG lets us know what your heart rhythm looks like right now. I do find that a lot of times the EKG won't show the cause, because the palpitations come and go depending on each individual. Every now and then I get lucky and I'll have a clue as to what's causing the palpitations, such as PVCs or skip beats. Every now and then I'll see that. But some people may need a longer monitor, and these monitors can include things like an MCOT or BioTel. There's different types of them. They can last as little as 24 hours, but can go as long as 30 days. And we're hopeful that we can help uncover what's causing the palpitations with that. I do find that there are occasions where we cannot, keep on hearing things behind me, where we cannot, and you may need a longer monitor. There's different ways that we can attack that. You can use a loop recorder, which is a monitor that's basically surgically implanted under their skin that can go for several years. One of the biggest reasons that we use that is for people who have had a stroke and we're concerned that it's due to an abnormal heart rhythm that we haven't been able to uncover, especially if they've had multiple strokes, because there are certain medications you should be on if you have had a stroke to prevent future strokes, but we don't want to start it if we can't find the cause. So that's one thing. And another one is you can have your own personal monitor. So an Apple Watch is an example of it, but Cardiomobile is another one where you put your fingers on the monitor and it gets you basically an EKG. And it can be helpful in certain situations because I've had a couple of patients where the heart monitor has been negative and then they got their own cardiac mobile and they were able to uncover what was causing their palpitations. So those can be very helpful too. And I think the Cardio Mobile costs about $60, $69. But I'm gonna give it maybe one more. No, I'm getting close to the area that I never checked out before, so I'm gonna try to check it out this time around to see where it leads to. Maybe I shouldn't check it out, but I am. Those of you guys coming on, my name is Dr. Issa, and let me know where you guys are coming from. Let me know if you can hear me okay. Using this live to just talk about your heart and your health, and if you have any questions, drop it in the comments. Welcome, welcome. You guys coming in, let me know where you're coming in from. All right, it's taking a little bit of a 20-30 minute walk before I see my first patient, but kind of see if I can answer a few more questions before I hop off. I don't think I ever took this trail. I never took this trail, so I think I'm going to try to see where it leads to. Hopefully nothing that I will regret, but let's go. Welcome, welcome for the people who are just logged in. Let me know where you're coming from. See people from a little bit of everywhere. On my last 10 minutes on here. But yeah, let me know where you guys are coming in from. Let me know if you guys have any questions regarding your heart, regarding your health, prevention, and just any questions that you guys have. You know, what it takes to become a doctor, what it takes to become a cardiologist, how much does a cardiologist make? Let's go. Not sure where that trail goes, but I should not try to find out. So a little bit about myself. Born in Nigeria till the age 6, moved to America, moved to Atlanta originally. From Atlanta, my mom moved us to Tennessee, where she was a psychiatrist in one of the hospitals. Played football in high school and ended up having a pretty bad injury. And from that injury, I knew that I could not play football anymore, and wanted to follow in my mother's footsteps to becoming, I want to take this trail next time, but not today. follow in my mom's footsteps to becoming um, a doctor. I didn't know which type of doctor I wanted to become, so um, uh, one of the good things about medical school is that you can do a little bit of everything, including things like surgery, OBGYN, psychiatry, which was my mom, pediatrics, and kind of fell into internal medicine, and more because with internal medicine you can do a little bit of everything. Pulmonary critical care, hematology, oncology. Hey, good morning. Endocrine, rheumatology, a little bit of everything. And um, after I finished my internal medicine residency, I became a hospitalist and a nocturnist. So this means that I was responsible for um, inpatient admissions, discharges, but no outpatient responsibilities. And my schedule was typically 7 on, 7 off, which was pretty good. But of course, you get a little bit greedy and you start working on your off days, which kind of ruins the quality of life. But still loved it, was able to travel the world in that 16 to 24 months. Went to Nigeria, Costa Rica, um, Canada, Spain, Portugal, New Orleans, and New Orleans deserves its own mention. So that was one of the cool things about being a hospitalist. Was the time off? Hey, good morning. Was being a hospitalist, and was the time off, and just being able to travel as much as I could. So I think I'm gonna put these headphones on, not to listen to anything, but to give the allure, like I am listening to something, because it looks like I'm just. But yeah, I was a hospitalist for about 2 years, and then uh, went back to school to become a cardiologist. And one of the reasons is, as a hospitalist, I kind of knew I wanted a mix of inpatient and outpatient, but I also wanted to be focused in around one subject or one organ, if possible. I knew I didn't want to do GI because the thought of poop was not fun. What they do is extremely awesome. This wasn't for me. I did like pulmonary critical care medicine, but the issue with pulmonary critical care medicine was death, and I saw death several times and was just, it was kind of depressing at the end of it. So I knew that pulmonary critical care was not going to be for me either. So here comes cardiology. It gives me a mix of everything: inpatient, outpatient, some procedures, EKGs, echoes. And I knew that was for me. I think this is the end of that small little trail. I kind of liked it. Let me see what distance traveled. My watch tells me almost 0.6 miles. Well, that seems about right, I guess. But yeah, found cardiology and applied, didn't get in, applied, didn't get in. Yes. And then applied a third time and was able to get in. And it's been an amazing experience. No regrets about it, and pretty much living my dream, to be honest. I think that's a testament to faith that, you know, the old saying, if at first you don't succeed, try again, is true. So whatever you guys are going through in life, I think the biggest thing to understand is that no does not mean never. All right, I'm gonna give it about 2 minutes. And if anybody has any questions, I will do my best to answer it. But if not, that's all right. Um, Next, I'm just gonna give you a brief summary, and then if anybody got anything from this, rewatch it, skip to the parts that you like. But this is Dr. A saying using this platform to discuss your heart health and prevention. What we talk about is preventing a heart attack, preventing heart disease, preventing strokes. The risk factors for it includes things like hypertension, high cholesterol, diabetes, smoking, strong family history, sleep apnea, obesity, and not following up with your medical providers. If you treat the underlying issues, you hopefully delay and prevent heart disease from happening. So it's important to always see your medical provider at least once a year, if not more often, depending on your circumstance. When it comes to high blood pressure is a systolic number, the top number greater than 120. If it's greater than 140, we definitely want to be on medications. If it's 130 to 140, look at lifestyle changes to potentially reduce that. Weight loss, salt reduction is going to be the key things that you can do. Chest pain here is concerning. Pain that's worse with exertion, pain that gets better with rest, all concerning. Go get seen in the ER as soon as possible. You could be having heart disease, the blockage, it needs to be opened up with a stent. If you have several blockages, you need open heart surgery. If all of those are normal, then you're going to need to be worked up for other potential causes: pancreas, gallbladder, reflux, inflammation can all cause them. You can have palpitations that don't mean anything, but they can be as bad as something like atrial fibrillation, ventricular fibrillation, which is an emergency. We evaluate it with an EKG, heart monitor, and sometimes a loop recorder that can go anywhere from 2 to 3 years. Heart failure. You can have heart failure due to the heart not squeezing appropriately. It can be due to the heart not relaxing appropriately. If it's due to it not squeezing appropriately, this is termed systolic heart failure. You want to do a heart catheterization to make sure there's no blockage. If it's diastolic, the most common cause is high blood pressure. Treat that, but also you have to look at other potential causes: sleep apnea, autoimmune conditions that can be causing it. This is Dr. E saying, out.